Hi everybody, it's Dr. Gallinaro. Many people, they think that once they've been diagnosed with neuropathy, they just have to learn to live with it. Some of the medicines that they take actually slow them down. They feel tired. It's not uncommon sometimes to gain weight, feel more lethargic, and it's kind of it's a negative cycle, right? Somebody might be in their 50s, 60s, 70s. They're already slowing down. Now they're starting to feel less steady on their feet. They're not as confident, and now their risk of falls increases, which is really significant as you age. That's one of the biggest things that put people out of commission, where they fall and end up with a hip fracture or spinal fracture, which then leads to bed rest, which then leads to somebody really getting deconditioned. So the best way to prevent that is to improve your sense of balance, to increase your stamina and be able to function better. And it's always, it seems like there's always kind of almost an excuse, because your doctor wants you to lose weight and exercise, but how can you exercise because you're hurt and you can't move? So we think of it a little differently. We think about how can we do things passively in the beginning with diet, nutrition, passive therapies or modalities in the office, but also at home. So we have a home-based program that allows you to treat yourself at home every day, sometimes 1 to 2 times a day, in order to get your nerves to heal. And if you can stimulate the nerves and the nervous system on a daily basis, you will see changes in 60 to 90 days, sometimes see some significant improvements. It can take up to 12 to 18 months for your peripheral nerves to heal, but that is possible. So in your balance and sense of stamina can be improved, and then that winds up usually someone getting more active along with working with their diet and nutrition. We start to help people get 5, 10, 15, 20 pounds off their frame, which is obviously much better for their back and their knees and their hip and their feet. So we start with baby steps, and we start with simple things that people can do in the office and at home to start changing and reversing their neuropathy. And we look at it in a way that most people they're never exposed to. So if you want to learn more, maybe come to one of our upcoming workshops or seminars, just click the link below to get signed up or registered. And we look forward to teaching you more about how you can help yourself naturally reverse some of the effects and symptoms and damage of peripheral neuropathy.